Okay, I am just entering the patient's room. I've just performed hand hygiene. I have introduced myself to the patient as their care provider today. My name is Sarah, and I'm going to be performing a cardiovascular and peripheral vascular exam on you today. Can you just verify your first name with me?
Hattie.
Okay, and so Hattie and I have already reviewed her vital signs. Everything is within normal limits. Her blood pressure looks great, pulse is great, her respirations are great. So we are just going to start out the exam today by looking, just visually inspecting her body. I am looking for any kind of hyperpigmentation, which I do not know in her upper extremities, in her chest, or in her lower extremities or feet. I'm also looking for any kind of non-healing wounds, ulcerations, just any abnormalities that can be noted. I do not notice any pallor when I visualize her fingernails and her toenails. I do not notice any clubbing or cyanosis. Her hands are warm to the touch. Temperature is normal. I do not know any scars on her chest, so it doesn't appear that she's had any kind of surgeries. I also do not notate any scars on her legs, so I don't see any surgeries there. Hattie has revealed to me that she has a normal past medical history, no significant surgeries, and does not reveal that she has any cardiac history within her family as well. And so everything just does appear to be well perfused. We're going to check her eyes now for pallor. I'm just checking to make sure that it does not appear that she has any kind of anemia. Everything looks great. And so we also just kind of want to look down her body and just check her distribution of her hair, which all looks normal as well. Everything does appear to have normal findings. I don't notice any venous stasis or anything like that as well. And so I've also been noting the symmetry of her chest. I've been watching her breathe while she's been on my exam table, and I'm noting that she does not have any asymmetry. Her respirations are normal. I do not see any abnormalities in her chest wall at all. And we have her at a 45-degree angle because that is going to be the best way to perform her exam today. So in order to start the exam, we are going to just have her relax her head. I'm going to have her turn away from me. We're going to start by checking her jugular venous distension. And so I'm noting this jugular vein here. I'm just going to palpate. Okay, I'm going to have you turn your head back towards me this way. The vein does not appear to be distended. Let's turn it back one more time. If you're having any trouble visualizing that, it is helpful to use a pen light, and that will help just a little bit. Don't notice any kind of pulsations or anything like that, so that is good. And so, Hattie, I'm just going to have you breathe normally. I am going to measure your JVD at this time. In order to measure, you just want to utilize a note card at the highest point of pulsation, and then also use a ruler that is measured in centimeters right at the sternal angle. So you're going to measure perpendicular. When I'm measuring that, I am getting a measurement of about 3 centimeters, which is normal. Everything there appears to be within normal limits. So now we're going to palpate Hattie's point of maximum impulse. We're going to find this at the 5th intercostal space left of the mid sternum. So I'm going to start down here. It is best if your patient does not have any kind of clothing on. It does allow you to have a better visualization and palpation. So I don't notice any kind of shifts. We're also going to continue to palpate all areas here. So we have palpated her left intercostal space. We are palpating that tricuspid area. We want to move up here and palpate pulmonic areas. I'm going to do that second left intercostal space. While I'm palpating, I'm just checking for any abnormalities. I don't notice any kind of pulsations or anything that are abnormal. I'm also going to go ahead and move over here to this right second intercostal space. And I also want to palpate this aortic area as well. I'm just noticing normal movements here. I don't notice any parasternal heaves. Let's go ahead and auscultate. So she does have a normal exam finding as far as her 5 cardiac areas. Don't notice any abnormal visual movements. Apex is noted at the 5th intercostal space. There are no parasternal heaves, no thrills, no palpable sounds upon auscultation. She is non-tender to palpitation. So we are, and I do not note any murmurs throughout her exam. Earlier, we noted that her heart rate was 60 beats per minute, which is normal for her age as well. And it is a regular rate and rhythm. So we are going to go ahead and palpate her carotid arteries at this time. We're going to palpate those one at a time. So feels normal on this left side. Let's go ahead and feel it on the right side. I do not note any vibrations. Carotid pulse feels to be about 3+ on each side. We're going to go ahead and auscultate that as well. I am listening for bruise, and I do not note any bruise at this time. So that exam does appear to be normal. And we are just going to go ahead and move down now to her lower extremities. When I'm looking at her lower extremities, we've already kind of visualized that and gone through that portion of the exam, but we just want to note that they're equal in size and symmetry. I don't notice any kind of edema on either leg here, which is also a normal finding. Again, the skin is pale and pink with no cyanosis or clubbing noted in her nail beds. So we are going to check for, everything is warm to touch as well. We're going to check those pulses now. And so when we are checking the pulses, we want to check the femoral pulses here. Femoral pulses do feel within normal limits. Let's check our pulses back here, popliteal pulses. Feel normal there as well. We are going to go posterior tibial. We're going to go dorsalis pelvis. All pulses are equal bilaterally. I have about a 3+. I'm also going to go ahead and check these radial pulses here. We just want to check her brachial pulse as well. Again, all pulses are equal bilaterally throughout this entire exam. I'm going to check your capillary refill. Capillary refill on her toes. Capillary refill is less than 3 seconds. And so everything does appear to be normal. She does have a normal cardiac exam today. And we do not know any abnormalities. Thank you guys for joining in.